Hello, so today I will be discussing the purpose of oxygen administration. So oxygen is typically given to patients who are experiencing an increased work of breathing, hemodynamic instability, and also patients who are hypoxemic. And the goal of oxygen administration is to make sure the patient is receiving as much oxygen as they need. And some devices that might help with that would include the low flow systems and the high flow. So low flow oxygen systems would include the nasal cannula and the simple mask. High flow would include the high flow nasal cannula, non-rebreather mask, partial rebreather mask, and the air entrainment mask. So the difference between the two would be that high flow typically gives the patient precise as well as a predictable amount of oxygen. An example of that would be that the air entrainment mask comes with an adapter that tells the respiratory therapist exactly how much oxygen to give the patient. So with giving oxygen, it comes with some complications. So first you would have the oxygen toxicity, which is where you would give the patient so much oxygen to where you would literally burn the lungs. You could also give a patient too much oxygen to where the lungs collapse, and that is called atelectasis. If you give a hypoxemic patient 100% oxygen, you would cause the patient's brain to cut off the signal that tells the body to breathe. So that is called oxygen-induced hypoventilation. And lastly, if you give a neonatal patient too much oxygen, you can cause the baby to go blind. All right, and that's the end of my video.